My name is Guo-Ping Shi, Associate Professor of Harvard Medical School from Boston. I'm a basic scientist. I came to this meeting to present our most recent unpublished work in mast cells in obesity and diabetes. Our earlier studies to showed that the mast cells are pro-inflammatory cells that contributes to obesity and diabetes, and in mice, if the mice lack of mast cells or treated with mast cell inhibitors, those mice are protected from both diabetes and obesity. There is a small clinical trials just finished and reported that in humans, those patients with obese diabetic patients, those patients take the mast cell inhibitors, showed also reduced obesity, diabetes, as well as LDLs, total cholesterols, and triglyceride, and increased adiponectin and HDLs. Those are good stuff. So suggesting that mast cells are bad cells, are pro-inflammatory cells that are bad to the system, to the diabetes and obesity in humans and in mice. That's our earlier studies. However, for the past several years, we have seen a very strange phenotype that in OB mice, which the mice missing the gene called leptin, and those mice spontaneously develop obesity and diabetes. In those mice, when they do not have the mast cells, and those mice surprisingly gain more body weight and they develop more diabetes. So we try to figure out what's the problem with those mice, and we have spent the past maybe 5-6 years to answer that questions. And now we present here in this conference and showing that those cells, those mast cells, when they missing this gene expression called leptin, missing leptin expression, they completely change the cell phenotype from otherwise pro-inflammatory into anti-inflammatory cells. And those cells can produce low amount of pro-inflammatory cytokines such as interferon gamma, IL-6, and etc., but have increased the level of expressions of those anti-inflammatory cytokines like IL-10, IL-13, IL-4, and etc. So those are our initial discoveries. And mechanism-wise, at the cellular level, we found that those special sets of mast cells, unlike regular mast cells, those mast cells can promote macrophage polarization from M1 to M2, i.e. suppress M1 macrophage and promote M2 macrophage. This is the molecular cellular mechanism, how those cells can change their phenotype. Now, food experiment, we show that in adipose, in obese and diabetic mice, and when we give those cells give those OB, which is leptin deficient mast cell, to those mice has the disease, we can significantly block or reduce, attenuate the obesity and the diabetes in those mice. And hopefully in the future, we can apply this one in the clinic by using somehow some kind of method to block the leptin expressions, the mast cells, which I thought is very, at least we think is a very profound and surprising discoveries that missing one gene can completely change the cell phenotype of a bad cells to become good cells. And at least we confirmed that in the in vitro studies and in mouse animal models.